started. Now, I want you to know, as you saw in the invitations, that we will be selecting a winner of the most festive dress. And so Martha will be selecting the winner at the end. So please hang on at the end of this so that we can go ahead and she can.
I lost you.
Oh, no.
Well, as soon as we have lost both Martha and Joe, perhaps they will find their way back to us.
I think when they went to live stream is when we
Yeah,
lost
I think
them.
so. They made
Sorry
the
about
switch.
that. Yes,
And they're back.
there we go. Sorry about that. I don't know what happened, but as I was saying, there will be a winner for the most festive dress. So hang on for that. Welcome to Community Matters. This is Community Matters Conversations, and hello, my name is Joe DiCarlo, and I'm very excited to see you all here today. But before we get started, Chelsea will be our technology host, and she will go over some Zoom tips for us this evening. So Chelsea, I hand it to you.
Welcome. Well, it's nice to see so many faces and cameras on. We love to see you. So thank you for being brave and showing your faces. If you want to keep your cameras on tonight, which we highly recommend, we recommend you go into gallery view so you can see all of the guests. We will be encouraging discussion today, so you'll be able to ask Martha questions after her presentation at the end. If you're having any trouble, please send me a private chat and I'll be able to help you. When, as a reminder, you would have heard the message, but we are recording this session, and then we're also streaming it live to Facebook. And if you have any concerns about that, please send me a private chat and we can make sure that you remain anonymous. Right, I think that's it. Back to you, Joe.
Thank you, Chelsea. This month, we could easily rename Community Matters Conversations to Community Matters Celebrations, because this afternoon we are going to celebrate all the wonderful work of Medical Teams International, all that we've done and were able to achieve this past year. And who better to share the highlights than the president and CEO of Medical Teams herself, Martha Newsome. While Martha needs no real introduction, she does have an amazing story that I want to share with you. Now, even as a child, Martha dreamed of traveling the world to heal the wounds of suffering people. Over the years, that dream took shape, starting as an undergraduate at Wheaton College when Martha traveled to Cameroon, and later as she earned her master's degree in public health. Driven by her faith and commitment to service, Martha has spent the past 30 years helping people who are pushed to the margins. She spent more than 2 decades in leadership positions for international non-governmental organizations, implementing high-impact programs that have served thousands, hundreds of thousands of people all over the world. Welcome, Martha. We look forward to what you have to share this afternoon.
Thank you, Joe, and a huge welcome to everybody. Thank you so much for joining this Community Matters call in such a busy season. We know there's many things that you could be doing with your time, so we are just thrilled to have you join us. And I also wanted to have a warm welcome to some of our Hope for the Future members as well. So it's great to see such a contingent. And as we get started here, as Joe said, we're looking for who has a festive background or an ugly Christmas sweater. I think I'm going to see if Chelsea can advance the slides for us here. Thank you, Chelsea. And you can just go to the next slide as well. And as we get started, I just wanted to put up our values as an organization here, because these have been so foundational to weathering the COVID crisis and to the work that we have done last year, and it really speaks to how we seek to serve and love vulnerable people all over the globe. So really, our staff have been courageous and tenacious, and not just staff, but volunteers as well. Courageous, tenacious, accountable, selfless, and not alone. And so this has been a good grounding for our work across the globe as we have sought to work together, and just appreciate all of you joining in partnership with us in seeking to love our neighbors in this way. So as I go to the next slide here, which is just to share a little bit about the results that were achieved this past year with our 3 aspirational goals, I was just thinking a little bit about how sort of paradoxical it is that the world is really struggling. We've all had COVID impacts, haven't we? And that, in a sense, provides an opportunity for medical teams to do more. But it's not like we want to celebrate that we have this global pandemic and that things have been so difficult. So it kind of makes me think of Charles Dickens. It was the best of times, it was the worst of times. And of course, in the worst of times, we have an opportunity to show up and love our neighbor and really do more, which so appreciate the support of everybody on the call that makes that possible. So because of our team, we have been able to exceed a couple of these aspirational goals, and our strategy is to triple our impact in 5 years in 3 ways. First of all, our disaster capacity, which you can see there that we aimed to get to 25% this last year, but actually got to 50%. And I'll explain why on the next slide. And then in terms of the refugees and the displaced people that we serve, we also, this number hides the fact that in a good year, some refugees will be able to repatriate and go home. And so we had quite a few, for example, in Tanzania that were able to go back to Burundi, which is a really good thing. But for us to then continue to grow and be able to reach more refugees, we've got to keep working and expanding our programs to be able to do that. And then our 5-year goal for reaching our neighbors who find themselves in vulnerable situations here in the US was really around 33,000 to 36,000. And you see from the table that because of COVID and all of the mobile dental services that we've been doing, as well as testing and vaccines, that we actually got to 54,000 people, which was truly phenomenal. So again, the struggle with this aspirational goal is that we'll be able to continue it into the future, but we are really celebrating just the pure scale of being able to get to so many vulnerable neighbors. With that, I'll just go to a few celebrations that I shared at our recent all-staff town hall. And as I mentioned, the part of the reason that we were able to expand our disaster capacity is right there in that first bullet. So as the world has sought to respond to the conflict in Ethiopia, we first responded in Sudan because there was about 55,000 refugees that fled across the border. So we opened a program in Sudan, got registered, got busy, setting up health services in one of the refugee camps there by the border. And then the border closed. And so then more and more of Tigrayans were being displaced in the province of Tigray, which meant that we needed to go into Ethiopia as well. So we opened our second new program. Also, we're able to get registered, a huge answer to prayer. And our teams have been working under really extreme circumstances to be able to provide care in the midst of that conflict. I know there hasn't been a lot of news that's necessarily breaking through, but it has been perhaps one of the most difficult environments that we've worked in, perhaps even the last decade. And then I'm super proud that every single country program added our COVID services to the mix of providing life-saving medical care and strengthening the health system, working with the community, and then trying to layer on top of that, responding to a global pandemic like we haven't seen since 1920. So that meant educating the population and getting infection protection and control measures into the facilities, being able to train our health workers so they could identify it. We also are super blessed by our board. In fact, we've got our board chair on the call with us today, Mike Goodwin. And we were able to add 5 amazing board members to our board this last year. And so are really thankful for these incredibly talented volunteers who work with us to achieve our strategy. Also have started some diversity, equity, inclusion work. We worked with Dr. Brenda Salter McNeil. Some of you may have heard of her before, a real renowned author, pastor, consultant. So she worked with our internal staff that were part of the Diversity Council, and then handed over to a new consultant who will be working with us this next year, Nikki Lerner. So excited about the work that's going forward in that area. With all of the growth from expanded COVID programs, our HR team has been flat out. We added 125 new staff this last year. So they really haven't been able to breathe. It's been a very exceptional year for them. And I'm super grateful for the resilience of our teams that have continued to work under a lot of difficult circumstances. In fact, our Bangladesh team, our program manager left for leave and wasn't able to get the visa to come back in. And so our national staff just carried on. They did an exceptional job of continuing to provide services to the Rohingya in Bangladesh. So with that, let's go on a little tour around the world. And I'll just speak really briefly about some of the results in our country programs. First, I've already touched a bit on Ethiopia, but just want to dig in a little bit with a little bit more detail. And I'm going to ask one of our staff members to jump on here in a minute and share a story with all of you. When our mobile teams got there, they just discovered that the armies had really been pursuing a scorched earth strategy, which means that they were trying to eliminate economic businesses, farms, and health facilities. So every single health facility was destroyed. There was litter, everything was just scattered around the ground. And so our teams came in, and in fact, the staff were so afraid that they had run away. So when our teams came in, they saw that we were there, and they sort of crept back and started engaging with us to restore those health facilities. And proudly, 3 of them are back fully functioning, which has allowed our team to go to another site and really work with another IDP or internally displaced person site, and where there's 20,000 people who've been displaced, and provide mobile health services to that community. We've now have 500 community health workers who are working. And you may have heard about how difficult the food situation is. It's really bordering on a famine at this point. And so we're seeing huge numbers of moderate and severely acutely malnourished children and pregnant and lactating women. So I'm going to see if Sarah, who spent many months with us as our response manager up in Tigray, Sarah, tell us about the widow's oil. I'm sure everyone is really curious at this point.
Sure. Thank you, Martha. I'm happy to share. So as Martha mentioned, I spent 4 months in Ethiopia this summer into the fall. And yes, it was incredibly difficult context with constantly wondering if we were about to run out of something very critical to our operations, whether that be fuel or medicine or supplies or cash to pay our own staff. There's a story in the Bible that you may have heard of about a widow who was very poor and hungry, and all she had was a tiny bit of oil in her little jar. And a prophet told her, keep pouring the oil. And she's like, but I only have a little oil. She kept pouring the oil, kept pouring the oil, kept pouring the oil, and the oil never ran out. And in this story, she goes on to sell the excess oil, and she was able to pay her debts and feed her family. And I have, for many months now, called our Ethiopia project the Widow's Oil Project, because every time I think, oh, we're about to run out of fuel, we're about to run out of that antibiotic, we're about to run out of cash, we just keep being sort of given the next step, and we keep not running out. And so we're so grateful that we continue to be able to serve very vulnerable populations, but we don't do it by our own strength. And we're grateful for all of those like yourselves who have come around to support and to make these projects possible. Thanks for letting me share this story.
Thank you, Sarah. I just love that. So thanks for jumping on. Moving on to other corners of the world, I already talked a little bit about Bangladesh and the fact that our teams, we were about ready to exit, in fact, when COVID hit. And because of just the need to continue to provide the COVID services, the UN asked us to stay. In fact, asked us to transition one of our 5 health facilities into an intensive COVID treatment center, which became a model. So we were really proud of the team because that is the last one that has continued to operate, and they brought a whole bunch of teams through our clinic periodically to learn how our staff were running that facility because it was such a high quality facility. So proud to say that 94% of our staff are vaccinated. They're working with the community health workers to get those vaccines out to the Rohingya in that very densely populated refugee camp. And we have a new grant that we secured from the US government to help us with that of 1.1 million to combat COVID there. Moving on, Colombia has really grown up in COVID. So in the midst of lockdown, they have really, I just don't even know how they've managed to hire the staff, let alone get 2 projects off the ground and get to 6 locations where they're providing these really needed health services to Venezuelan migrants. So our model has been really warmly received by the government and the partners, and that in turn has helped us to grow that program because there's more than 2 million migrants, I believe, that they have estimated that have fled into, maybe even more, into Colombia. So we started with 12 staff. We now have 31 and are about ready to start another COVID grant from the US government this next fiscal year, which means that we will double the team by January. And that just means we're going to be able to reach more of these migrants. So we are really proud of the work that they're doing there. Let me touch as well on Guatemala. And as you see from that picture, Guatemala not only had to face dealing with COVID, but they had 2 hurricanes. So our staff literally carried in these supplies. This was not a staged photograph, right? They walked into the community to bring those supplies and to provide health services in 11 different shelters. We also expanded. We have been working with the Highland peoples that are really excluded from care, but our team then started at the request of the Ministry of Health to work on COVID prevention and getting supplies, getting infection prevention training to those health facilities and case management as well. So really almost doubled, at least 2 different locations now that we're working in Guatemala. We also have a long-standing partnership with Providence and are in the midst of designing the next phase of that program, which will allow us to go into new communities that haven't been served to date and advance that for the next 4 years. I'm going a little quickly just to make sure that we have time for a few questions. And then finally, our US program. I think it's, we all understand that, this pandemic hit the Northern Hemisphere first. That was because of the airline transit routes coming from China. So quite an unusual situation. Whenever medical teams has responded to an epidemic or an outbreak or a pandemic in the past, it's usually been somewhere else in Africa or the developing world. It really started with a vengeance here, as we all know and have been impacted by, but this has provided a real opportunity for our vans to be used and for us to engage with so many more partners. So many partners have stepped up to the plate. We've been collaborating with the Washington Department of Health, with Oregon Health Authority, other health system partners, and that's allowed us to complete 1,600 clinics. So our team have been averaging about 31 clinics a week, or 6 per day, which is a huge volume. And we're so blessed by the volunteers that serve alongside our team. So we've had 2,400 shifts that were covered by volunteers. And that's really, if you added up the value of their professional time, that's $1.4 million. And our team has expanded as well and includes both our full-time staff as well as some temporary staff. So we've seen this program more than double in the 18 months that we've been responding to COVID, which has really been phenomenal. Just recently, you might have seen there's been a little bit of PR that our teams were asked to help with vaccinating children. And so they've been getting out to the Title I schools to really get to some of these kiddos that just don't have a family physician, and their family may not have access to good care. And so we've been providing the vaccines for them at those Title I schools.
Mason, Chloe,
So
we're going to leave in about 5 to 10 minutes.
So with that, I think I will just pause and let Joe, who is our wonderful MC here, see if there's questions, give a chance. I know some of you know each other. We have a few minutes here. We'd love to hear if you've got questions.
Yes.
Yeah.
Yes, thank you, Martha. I guess one of the things I'm taking away with just listening to you recap all that we've done this past year is that despite a lot of challenges in our world, we've been able to transition them to opportunities to serve the needs of people here at home and around the world. As you think of your questions, feel free you could put them in the chat. I'll monitor the chat, or I recommend though that you unmute and turn on your video so we can see you. But if you have a question for Martha, this is your chance, President and CEO. You have a chance to ask her anything you'd like, and we'll do that now.
Don't be shy. Nobody ever wants to be the first one, right?
Let me start them off while they're thinking and getting up their courage. Martha, we haven't planned this, right? So I'm going to ask you, what keeps you up at night? What are the biggest challenges that you face in your role?
Yeah, that's a great question, Joe. And I think most recently, as I sort of alluded to, our response in Ethiopia has been one of those things that keeps me up. There's usually multiple, so that could be a multiple choice answer. But really, the security situation, we have struggled to even figure out how to carry cash, how to keep our Tigrayan team operating. And as we heard from Sarah, they have just been phenomenal in making it happen. Every single time that we thought we've hit a wall that's insurmountable, something has happened. But we've had staff carrying cash in quite literally to keep those mobile clinics going. So that's been a concern. And as that conflict has spilled out of Tigray and started to impact other provinces, that's also been a big concern for us. But even this week here at home, there's Seaside just had a little bit of a scare this week, and our US program had to cancel 3 clinics. Luckily, nothing happened, but it was a lockdown just in case. So we're also facing a rather, it's a tumultuous time. I think a lot of people have suffered a lot through COVID. And so our team here this week was impacted as well. So it's those sorts of things that keep me up.
Yeah. You listed our values of courageous and tenacious. And so we're being asked to live them out, aren't we?
That's right.
What other questions? Feel free to ask.
Martha?
Yeah, go ahead.
With your international programs, what have been the biggest challenges with COVID? Are you able to get access to all the vaccine you need?
That's a great question.
How about treatment, in these camps where there aren't hospitals close by?
That's right. So that's a mixed picture because it's almost country by country, but I would say in general, the vaccines are starting to get out to the capital cities, but what is proving to be more difficult is the distribution. These have to they have to stay at a really cold temperature. You've got to have that elaborate cold chain to get them, into the arms of the whole population. So the level of coverage of the world is still much lower than we want it to be. And in some cases, it's not so much access, it's just delivery of those vaccines. So that's been one constraint. Interestingly, there was a lot of predictions early on that we might see, massive death rates in some of these refugee populations. That's why there was such an advanced plan for the Rohingya in Bangladesh. And that hasn't happened. It's been really interesting. And there's been a lot of theorizing about why, these are younger populations, they're able to be outside, which we've seen in the summer is better, right? Less transmission. So we haven't seen as much of the dire kind of scenario that was expected, which is good because we didn't have all those oxygen, we didn't have everything that was needed. We didn't have the high tech response. It was fairly low tech. But we've had no COVID deaths amongst our staff. We've had a few positive cases. Everyone has recovered. And I think that's just the grace of God that everyone has been safe on our US team as well.
Oh, wow, thank you.
Yeah.
Great questions. Who else?
Okay, I'll ask another one.
Hey, Sheila, great.
As you're expanding your staff in some of these other areas, are they continuing to be in-country staff?
Yes, predominantly, although we also, one thing that's been an opportunity whenever there's, extreme change, it forces us to do things differently, right? So working virtually has helped us in a sense to be able to say, hey, we can access really high quality staff elsewhere in the world. And now that we're virtual, it's much easier to plug them in. So we just hired an amazing international finance director who's Kenyan, based in Nairobi. So in fact, we've just become more and more virtual at our headquarters with hiring international staff, whoever's best for that job, wherever they are, which has been great. But certainly we've expanded our national teams for the most part.
Okay.
So Martha, what do you see as the challenges in the upcoming year? There have been so many challenges behind us and so many celebrations and blessings, but what are you thinking of ahead? What do you see as the barriers for this upcoming year?
Oh, thanks, Connie. That's a great question. Maybe I'll answer it on two levels. One, with Omicron, we've all been reminded that if we can't get those global vaccination levels up to a herd immunity level, that we are kind of all stuck in purgatory a little bit, right? Because the virus is just going to continue circulating and we'll get new variants. And so I think as medical teams seeks to come alongside these really vulnerable populations, we want to see those vaccine rates go up. So we actually have some proposals pending with the Global Vaccine Alliance and are hoping that we can be part of the solution in terms, just like we are here in the US. So that's kind of the global scene. And then I think for us internally as an organization, this growth is, puts a lot of pressure on our systems. So we have expanded institutional funding and had a lot of very generous, most of that COVID funding that I was talking about is coming from our US State Department, from the Bureau of Population, Refugees, and Migration. But with that, we often need to increase our finance and HRIT logistics capacity. So where we're going to struggle, I think, this next year is how do we backfill and build out those areas that people are less likely to fund. So that's why you all are such amazing and important partners to us, because that helps us to build that capacity to really keep up with just the global need that's out there.
Thank you. That's really helpful to know and understand.
Well, Martha, I want to, go ahead.
This is just a quick question. This sort of mix of US physicians being on volunteer teams versus international physicians or local physicians and health staff, is that really markedly decreased, or are you still sending US-based physicians on short-term teams?
Phil, it's an excellent question. No, we really have not, because we kind of clamped down on international travel. So our volunteer teams we've not been sending them. We still have an essential travel essential travel policy in place. So really scrutinize every single trip. It's just because everything keeps changing, so it's not only the US changing what's required to get back into the US, but for any one of us to get into one of these countries, that's a constantly shifting scenario too. And so we really have been able to continue with a few expats that are out serving with us and the national staff that are working with them. They've been phenomenal.
Thank you.
Well, thank you, everyone, for your questions, your great questions. And thank you, Martha, for responding. And before we close, all what you've been waiting for, we're going to have Martha choose the winner for our most festive dress. So have
Is it
your
festive
cameras.
dress or festive environment, maybe?
Festive wear and or backgrounds, let's say that.
Mhm.
And so, and there might be more than one screen, Martha. You might have to advance because of a large group of people.
Actually, I think I can see everyone, but that's a good point. I hope I'm not missing anybody because this is a very important contest. Because we have a small gift for you. I think maybe Phyllis, I see that. Is that an Advent set of candles behind you there?
Actually, it's a cutout of Peace on Earth sitting on top of my microwave.
Oh, nice. Well, and I can see some red candles as well. So I think I'm going to choose
yes,
you.
right.
Yes, I think I'm going to choose you. And Phyllis, maybe just the rest of the folks on Zoom would love to hear your link to medical teams.
Well, thank you for that. I just wanted to point out that Northwest Medical Teams International was reborn in 1985 with the call to go to Ethiopia. And we had been sort of dormant, giving and praying, but not necessarily sending teams after Cambodia. And so to hear that we're responding so courageously to Ethiopia now is wonderful. When we were there before, we were in Ibnat and Lalabalan, which is in northern Ethiopia. And the difficulty there was what they called shiftas, that bandits that guarded all the roads. So we had to partner with World Vision to fly in to northern Ethiopia. So I guess that was sort of my question too. How far north are we? Are we really in Tigray, or is it in Ethiopia? Yeah.
And our team has been based in Shire. So those of you who want to Google a map of Ethiopia, you can find we're not in sort of the capital of that province, sorry, but in Shire, which is a smaller town. But they've been going all the way up to the Eritrean border. So quite far north as well. So I wonder, well, I'll have to look up those towns. But thanks for sharing that. So really, it seems like we've come full circle in some ways, that we're back in Ethiopia. And I had some correspondence actually with Ron Post, the founder of Medical Teams, along those lines, you know, telling him what our teams were doing up in Shire and Tigray, and actually hoping to move into the adjacent provinces as well.
Yes. Well, I want to thank you all for participating in this Community Matters Conversations. I want to give a special shout out to our Hope for the Future members as well who are on the call. I just want to, as Martha has acknowledged, I also want to acknowledge your participation as well. We hope you enjoyed connecting and celebrating this year with us. And I also want to let you know that we have some upcoming events. There's the, let's see, make sure I can see this. There. Sorry about that. I'm having some technical difficulties. Tuesday, January 4th, there's a chapel broadcast. We're going to have some special chapel meetings that you are invited to attend. We have chapel every Tuesday, but we have special invitations for others to join as well. So you're welcome to join that. Thursday, January 9th, Community Matters Conversations, our next one. And on the 19th, Healthy Women, Healthy World Book Club. These are very special events that you can participate in, and just go to our website, medicalteams.org, in order to RSVP.
Thank you, Joe. If I may, I just found this wonderful quote from Mother Teresa, and I thought it was so appropriate as we close here, that love cannot remain by itself. It has no meaning. So let me repeat that again. Love cannot remain by itself. It has no meaning. Love has to be put into action, and that action is service. So thank you all for putting your love into action and service with us. We depend on you, and we're a big team, and appreciate everyone, and wish you a really blessed Christmas and a happy New Year,
Thank you.
everyone. And now those who want